Welcome back to an ABC 57 half-hour special, Conquering the Coronavirus. Even after his plasma transfusion that saved his life, Dr. Hamel had a long road ahead, and he has a message for everyone touched by the pandemic in some way.
Probably worried more afterwards when I came off the ventilator and I was still really short of breath, and the second night felt worse than the first. You know, I know some of the things that can go wrong and some of the ways that people who are doing better start to get worse again.
The COO at Spectrum Health Lakeland in St. Joe, Dr. Lowell Hamel, says it certainly wasn't easy going from running the sprawling hospital complex in the midst of the COVID-19 pandemic to being treated for that very same disease inside.
It's one of the challenges of treating family members as a physician, because you can go too far in how quickly you react to something.
It's noticeable for those that are taking care of any of us that, in fact, I'm taking care of my boss, or my boss's boss's boss, as it may turn out. But it's something, it's a privilege to take care of our own family and healthcare, and it was a privilege, of course, to take care of Lowell when he was sick. We would certainly like to think that we treat everybody that comes to our doors with love and respect, and we treat everybody with the very best we possibly have. No question about that.
Dr. Lowell Hamel, the hospital president and CEO, worked tirelessly to keep from losing his twin brother to the virus. They were both committed to fighting together.
This was very personal to our leadership team. It was very personal to Spectrum Health Lakeland. The amount of love and the amount of support and the amount of prayers was just so incredibly appreciated. At times like this, it feels good to be surrounded by family. It feels good to be surrounded by support, by colleagues.
This is the family Christmas that we do every year. We get as many of us together as we can.
The entire family credits well-timed, state-of-the-art medical intervention, the power of prayer, and this very visual reminder of why Dr. Hamel had so much to live for. A montage of family photos in happier, more active times, put together by his daughter Katrina as her dad was on a respirator in Grand Rapids, in very real danger of losing his life to COVID.
I think it was exactly the right thing, and she knew it, and as soon as she knew it, she put it together. She drove 3 hours to deliver it, and it was probably one of the last things my dad saw before he was put to sleep to be intubated, and it was one of the first things he saw when he woke up.
As an ICU nurse dedicated to helping save other patients from COVID, Lowell's daughter Danelle recommends all families who can't visit their loved ones right now do the same.
In this time where caregivers are separated by actual physical barriers from their patients, and we're having to be hyper-vigilant about contamination, it's hard to connect. They were able to connect by seeing him with his family, and I think the value of that is not measurable. I mean, it was priceless what she did. I would encourage anyone who has a family member in the hospital that you can't visit, send pictures in. We want to see it. Your family member wants to see it. It's not nothing.
My daughter, who works in the ICU, has become a COVID warrior since my illness and has dedicated all of her time in the care of COVID patients. And that is a sacrifice. People do that for you know, in my view, very high-minded, moral, compassionate reasons.
And at a time when other first responders, firefighters, police officers, and ambulance crews take the time to parade past Lakeland Hospital to say thank you to all those healthcare heroes inside, Dr. Hamel knows firsthand just how vital and dangerous their work really is.
I very much appreciate what somebody does, particularly as it includes additional risk to themselves. And in COVID, that is clearly the case. Everything we do is not as much as we would like to be able to do. We don't have all the evidence back. We think we have a pretty good idea how to make it safer for folks. But the fact that the incidence of COVID in healthcare workers is higher than the population is confirmation that what we're doing is not entirely adequate. And healthcare workers know that. They know they're taking extra risk.
Well, many of us who are at the hospital are COVID warriors, doctors, nurses, nurse aides, respiratory therapists who often get forgotten for some strange reason. They're very necessary with this respiratory complicated virus.
Despite the risks, Danelle Arnold is now volunteering to work all her shifts inside the Spectrum Lakeland Coronavirus Intensive Care Unit, treating the sickest COVID patients, in part to honor her father.
I think it's only natural that when something tries to hurt your family, you want to hurt it back.
And while he doesn't know the anonymous coronavirus patient who donated his life-saving plasma, Dr. Hamel says he can't wait to do the same for others.
Are you going to donate when you are able?
As many times as I can, and as soon as I can.
How will that make you feel?
You know, it'll make me feel good. Better still if it's used, if it was necessary, but to just have it in the bank available if somebody needs it will be very satisfying. And I encourage anyone who can to donate.
As states like Michigan and Indiana struggle with when to reopen their economies and whether people should be wearing face masks when they go out or not, the doctor has one simple message.
I would encourage anybody who gets too worked up and exercises their political views in debating what should be done on COVID, give it a break. We're all in this together. People, I think, are doing the best they can. One can always argue on the timing. One can debate whether we're doing too much or too little. This is uncharted territory for everybody.
And nearly losing his life to the virus he was dedicated to conquering will forever change whatever time he has left.
I have obviously known from an early time that life is limited. Having said that, we frequently act as though it's not. And when you have an experience like this, it does open your eyes to be thoughtful to the time you have. How would you like to spend that time? Who would you like to spend it with? Hold those you love closer.
Dr. Hamel is now walking more than a mile a day, and he's not taking any medication for the disease. In fact, he's even back to work part-time at Spectrum Health Lakeland, an even more dedicated COVID warrior determined to conquer the coronavirus. I'm Conybeare, ABC 57 News.